Hello and welcome to our presentation. Today we will be discussing otitis media, what it is, how prevalent it is, as well as comparing the experiences of two individuals who have experienced it.
What is otitis media? According to the Oxford Concise Medical Dictionary, otitis is defined as inflammation of the ear caused by viral or bacterial infections. For those who suffer from otitis media, this typically occurs in the middle of the ear, the space behind the eardrum linked to the back of the throat through the eustachian tube, where the inflammatory response blocks the eustachian tube, leading to fluid and pressure buildup, ultimately housing bacteria or viruses. Depending on age, symptoms of otitis media varies. However, as it is most common in children, symptoms include upper respiratory infections along with fever. They may experience irritability, disturbed sleep, earache, ear tugging, eye discharge, sensations of fullness in the ear, dizziness, nausea, vomiting, and hearing loss. In mild cases, treatment typically includes antibiotic therapy. However, in more acute cases, a tube may be inserted into the eardrum, or minor surgeries in the middle ear may take place in order to equalize pressure and prevent fluid buildup. In the case that otitis media is left untreated, the infection in the middle ear can travel to other parts of the head, cause permanent hearing impairment, and even hearing loss. How does otitis media affect Aboriginal and Torres Strait Islander populations? Due to the lack of awareness and health inequalities amongst Indigenous populations, in regards to otitis media, such ear infections are often undiagnosed and untreated, which can result in hearing impairments, hearing loss, and other health complications. Poor hearing health amongst Indigenous children in particular can affect their cognitive development, auditory processing skills, and speech and language developments. These foundational problems can cause negative and lifelong social consequences amongst Indigenous communities, as it can lead to behavioral problems, poor education, and increased antisocial behavior, which can cause future employment and income limitations, increased run-ins with the law, and further health complications.
Within the Aboriginal community, otitis media is said to be a significant health issue according to Latzel and Hunter. Otitis media is common amongst all young people. However, it is more prevalent in Indigenous and Torres Strait Islander communities, as the onset for this infection is said to occur earlier and continue for longer after the child's first year of life. In accordance with Jervis, Barty, Sanchez, and Carney, the prevalence, that is, the proportion of cases within the population of Indigenous children, is 7.1 to 12.8% for acute otitis media and 10.5 to 30.3% for active chronic otitis media. As stated by Robinson, Hoskins, Page, and Peckham, non-Aboriginal and non-Torres Strait Islander children experience common episodes of otitis when their immunity is reduced. However, the episodes settle within 12 weeks for the vast majority of cases. In contrast to this, Indigenous and Torres Strait Islander children do not tend to develop episodic otitis media and experience chronic otitis media early in life, persisting into their upbringing. Although this source is quite outdated, it is still evident that otitis media is still prominent in Indigenous and Torres Strait Islander communities in today's society. The Australian Institute of Health and Welfare articulated that although incidence is highest and most common amongst all children aged 6 to 24 months to experience otitis media, Indigenous and Torres Strait Islander children have more frequent episodes of greater severity, persisting longer in comparison to non-Indigenous children. In 2016, the Northern Territory Remote Aboriginal Investment Hearing Health Program for Remote Children conducted a study including 2,300 children and young people aged 0 to 19 years old. Of these individuals, 47% of them had some form of otitis media, showing that this infection is prominent in these communities. In addition to this, 65% of all children aged 0 to 2 years of age had otitis media at the time of the study.
In order to understand otitis media, the importance of understanding the lived experiences of individuals allows us to compare and contrast the differences in strategies they have implemented, the outcomes of those strategies, and how otitis media has affected their lives. In this next segment, we will be discussing the lived experiences of two individuals with similar cultural backgrounds and how they have experienced otitis media across their life.
We are going to discuss two Indigenous women's experiences with otitis media. The first Indigenous woman is the mother of a son named James. James' mother was not aware that he had otitis media until he reached school age. James never showed any signs of otitis media as a young infant. These signs include ear infections, pussy ear, irritability, and a change of behavior. The second Indigenous woman is a mother of 3 children and also has a grandson with otitis media. She also experienced otitis media herself as a child. She said that her children learned to lip read and read body language in order to understand what was being said. She suggests that having otitis media can result in a low self-esteem due to people believing you are stupid and don't take you seriously.
Both Indigenous women are mothers of children with otitis media and therefore have shared the same experiences in monitoring their child's health through medication and health precautions to prevent the development of other health conditions, e.g. washing of hands and eating healthy. Also, both women have felt responsible for their child developing otitis media and believe that it was due to poor parenting on their behalf. Because of this, they held an element of stigma from the community as they were viewed as not taking proper care of their child's health. James's teacher has an understanding of otitis media and how it impacts James in a learning environment. Therefore, his teacher adapts her teaching and makes sure he can hear to reassure that he is engaging and learning. Contrastingly, the grandmother said her children struggled at school, as they could not learn when they could not hear. Her grandson has also struggled at school. He said that when he asks the teacher more than once to repeat something, the teacher thinks he is trying to be smart. The grandmother has also experienced otitis media herself, and therefore has a wide understanding of the impact of the condition, both physically and socially. In contrast, James's mother has not had prior experience with otitis media and may not have as rich of an understanding of the condition. As discussed, both Indigenous women have had both similar and different experiences of otitis media.
Today we have learned the characteristics of otitis media. It is an inflammation of the middle ear caused by a viral or bacterial infection, leading to a buildup of fluid against the tympanic membrane, which can cause pain, discomfort, and loss of hearing to those it afflicts. As mentioned earlier, otitis media has a severe prevalence in Indigenous populations, with 7.1 to 12.8% of Indigenous children experiencing cases of acute otitis media. This prevalence has the possibility of leading many young Indigenous Australians to fall behind in school and employment opportunities due to decreased social, educational, and cognitive development if left untreated and allowed to reoccur. We must recognise the significance that otitis media has on the community, as the implications of the social and educational shortfalls caused by the illness can impact the mental health of the population. Individuals with otitis media may find difficulty with the stigma associated with hearing loss and the development issues related to it, especially those within regional communities. Thank you for listening to our presentation.